So here we have the general population, and some of this general population will be infected with COVID-19, with the virus. Then they have to go through this tube here, which is the disease process, probably lasting for about 2 weeks in most cases. Then there's going to be outcomes. We hope the vast majority will go into this recovered box here. Some will go into this box here and death will be the outcome, unfortunately. And others may go into this box here where they survive but they're left with sequelae. Now, sequelae are complications following a disease process. So, for example, if there's residual damage to the lungs or the heart, this would be sequelae. And we have no information at all on this, whether they occur, how severe they are, what kind of incidence of sequelae there is. We don't know that at the moment. That's not in any literature just now. So that's the disease process there. And this explains why we have a lag in our figures, why we're not unsure of the figures. We don't know quite who's going to end up in this box or this box, because this takes a couple of weeks. And then the process from when someone's feeling better to death could take some time as well, potentially. And we know that in the Dr. Lee case, his death was 27 or 28 days after his initial onset of symptoms there at the start of this disease process, this disease tube that infected people have to go through unless they have a completely asymptomatic course of the illness. Now, next today I want to go through some of the figures for Sunday the 16th of February 2020. And SARS coronavirus type 2 is the name of the virus. The disease it causes is COVID-19. This is the World Health Organization nomenclature now. Now, confirmed current cases seem to be about 57,165. Now, I know there's... we know this isn't right. I mean, everyone agrees that the cases are higher than this. The Chinese authorities agree that the cases are higher than this, but this is the official figure. Accumulated confirmed cases is that 69,270. Suspected cases. Now, severe cases. This is what concerns me here. Severe cases. Quite high, 11,272 severe cases on my Chinese website today. Now, if you take the percentage of severe cases with current confirmed cases, so you relate that number to that number, that gives us 19.7% of cases are severe. And even if we add that number to that number, the suspected cases are all actually the disease, that still gives us severe cases of 17.2%. And this is higher than it has been. And this is remarkably concerning, because if there is a pandemic of this condition, and it's still an if, but quite a few indicators now indicate we're in the early stages of a pandemic. But if there's a pandemic, then 60% of the world's population could be affected. That means that the current cases would be in the billions. Now, I know in the National Health Service in my country, we had 60% of people in the country that were ill, even over the course of a year. There's no way we can look after 20% of them in hospital. Just no way at all. So quite what that means, well, I know what it means. People are going to die. It means that there's going to be severe cases. There's going to be severe cases that will die that otherwise could have survived if they'd had more access to medical care. And in poorer parts of the world, this is certainly going to be true. Confirmed deaths so far, 1670. And deaths to, if you relate that number there, the accumulated cases, to deaths, that gives you 2.4% death rate. Quite high, quite high. It's assumed that the death rate is going to be lower than this because there's a lot of minor cases that are not reported, that don't come to the attention of the gatherers of these statistics. But there again, some people die at home who never get onto the statistics, so it kind of works both ways. But I think the cases that aren't officially diagnosed would mean this number is smaller, but it's still quite a big number. Recovered continues to climb, which is great. And the Chinese criteria for recovery are quite strict. 29 countries affected. Egypt has been affected recently. And that gives us an R0 of 2.6. Well, that doesn't give us an R0 of 2.6, but we think that is what the R0 is from the best current estimates. Although in the next part of this video, we'll look at things that might be reducing that R0 figure. So I want to go on to some news items that have caught my attention today. But just before I do that, I've had quite a few complaints about the last video, the one I made about a small number of infants being infected. And a lot of people are referring to a video appalling video really, where children's bodies are put into body bags. Now the point is we don't know what that video is or where it is or if it's genuine or anything. We don't know anything about it. But I do know what is in the authorised medical journals. And basically we've got to go with the evidence. So, if there's evidence in the medical journals, we've got to go with that. And if that disagrees with what I'd like it to be, tough. If it disagrees with what you like it to be, tough. If it disagrees with what I believe for years, tough. We have to go where the evidence leads us, no matter where that is. Even if we don't like the place where the evidence leads us, or we don't think it's where we'd like to be. We have to go with the evidence. Anyway, go on to some items of news that caught my attention. Now, this Diamond Princess cruise ship. So we know there was a patient on it from the 20th to the 25th of January who was asymptomatic, but was later diagnosed with the disease, and then it went into quarantine, as you probably know, in Japan. Now, as of today, 355 people have tested positive on that ship. Is going up dramatically, and only 1,219 have been tested. So the US, Hong Kong, Canada and Italy are repatriating their citizens from that ship. But it just seems so clear now that the infection is being spread on that ship. Now, how it's been spread is difficult to tell. Could it be infected members of the crew? Could it be contamination of food? Could it be in the air conditioning, especially for people that are in inside cabins? It's currently unclear. But what is clear, of the 355 people, getting on for 10% of those on the ship, they've caught that disease on the ship. Of that I would be fairly sure. I'm open to evidence to prove that they were all incubating the virus when they went into the quarantine period. But if I was on that ship now, I would be pretty uncomfortable just waiting to hear if I was picking up the disease. Now, the Westerdam was the other cruise ship, the one that unloaded in Cambodia. And one woman from the US has tested positive subsequently. I think she was tested positive in Malaysia. So she got off the ship. She was infected. Then presumably she got on the bus. She got on a flight. You don't need me to spell out the implications for that. Now, I've noticed there's protests in Hong Kong about treatment centres in crowded neighbourhoods, and this is because we're not really sure how it's spreading. So I can understand that concern, because if this is spread in the air with the airborne and aerosolisation, then their concerns are well justified. If it's only spread by close contact, then their concerns are not as well justified. But the Chinese response to this now is just amazing. I listened to a website today, a main international news broadcaster, and it said 760 million people are quarantined in China. That's 10% of the world's population. So quite incredible, really. Beijing is virtually shut down. anyone returning to Beijing after their holidays has to self-quarantine at home for 14 days, or there can be severe repercussions. So it's hard to see what more the Chinese could be doing really at the moment to protect the rest of us and the rest of their citizens. It's that level of shutdown wouldn't work in my country, I don't think. But it's let's hope it works, because it makes sense to isolate people. It's what makes sense. In Hubei province, private cars have been banned. Virtually everyone's staying at home, and food is delivered in bulk to the door. And the Chinese bank is storing and it's not a funny matter. They're storing and disinfecting banknotes, and the streets are being disinfected. Now, in my country, in the UK, 8 out of the 9 people in hospital have been discharged after 2 negative tests. Now, the only slight concern there is these tests are done from the upper airways, and this disease can be in the lower airways. But I'm trusting my doctors. I think the UK doctors have probably got that right. So these people discharged are now safe. And the 8 that have been discharged, I don't know about the 9th, but the 8 that have been discharged required what's called minimal medical treatment. Now, what minimal medical treatment means, I don't know. But mathematical modellers have told us that if there's a pandemic, then, like the rest of the world, 60% of our population could be affected. And that would result in many, many deaths. I'm not going to throw out a number, but it would. So, some modellers are saying that the disease will be in my country, in the United Kingdom, in 2 to 3 weeks' time, and it will be spreading from person to person. And in 2 to 3 months' time, there could be a peak of the epidemic. And this could be the same in many other countries. We hope not, but it's possible. It's not ludicrous now that we are to suggest that we could be in the early stages of the pandemic. So, good hygiene, reduce your social contact. We need to stop hugging and kissing, and we need to stop shaking hands for a period of time. I think we should start doing that now, really. So just get into the habit of not kissing people. Certainly don't kiss babies, and stop shaking hands. If everyone did it, it's fine. We're not being unfriendly. We just don't want to infect each other. Just do away or something like they do in Asia. I don't know, but we need to change social habits to at least slow down the spread of any potential infection. Let's hope this has been an overly pessimistic video and the Chinese curtail it and it all goes away. But the possibility that we're in an early stage of a pandemic does need to be considered at this stage.